Okay, so three anterior visceral branches of your abdominal aorta is your celiac trunk, inferior mesenteric, superior mesenteric artery. Si celiac trunk at the level of L1 will give directly your splenic artery, left gastric artery, and common hepatic artery. Si left gastric artery, aakyat siya papunta sa cardia of the stomach, and then will give rise to your esophageal branches that will supply the lower 1/3 of your esophagus. Si left gastric artery will continue downward sa lesser curvature of the stomach and will anastomose with right gastric artery. Splenic artery will give your short gastric arteries that will supply the fundus of the stomach. Splenic artery, magbibigay rin siya ng branches sa spleen. Splenic artery will give out your left gastroepiploic artery. That will move, or parang susundan niya yung greater curvature of the stomach and will anastomose with your right gastroepiploic artery. So left gastroepiploic will supply the upper greater curvature of the stomach. Common hepatic artery, so yun nga, will give your right gastric artery that will supply lower right stomach sa lesser curvature. It will give, tapos tutuloy siya magiging proper hepatic artery and give your left and right hepatic artery. Si right hepatic artery will give your cystic artery. Cystic artery will supply your gallbladder. Right left hepatic artery sa liver. Hepatic artery will give your gastroduodenal artery. Gastroduodenal artery will give two branches, superior pancreaticoduodenal artery and right gastroepiploic artery. Right gastroepiploic artery will supply lower greater curvature. Pancreaticoduodenal artery will supply upper part of duodenum. And then, meron kang superior mesenteric artery. And superior mesenteric artery, unang branch niya is si inferior pancreaticoduodenal artery. Inferior pancreaticoduodenal artery will supply lower part of duodenum and magsusupply din sila sa spleen. So, kung i-imagine mo, may parang stomach dyan, tapos ito si spleen somewhere dyan. Head ng spleen, tapos pa ganun. Imagine mo na lang. Tapos, it will give rise, sunod si middle colic artery. Middle colic artery will divide into right and left, right and left, that will supply the proximal 2/3 of the transverse colon. Magbibigay rin siya ng, to the left of the superior mesenteric artery, jejunal and ileal branches. That will form yung mga anastomosis or yung vasa recta. Right colic artery, bibigay siya ng right colic artery that will divide to ascending and descending branches. Ileocolic artery that will give superior and inferior branches. Inferior branch of the ileocolic artery will give your posterior cecal artery and anterior cecal artery. Posterior cecal artery will give your appendicular artery that will supply appendix. Posterior anterior cecal artery supply yung cecum. Ileocolic and right colic will supply ascending colon. And then you have your inferior mesenteric artery that will give your left colic artery, sigmoid artery, and superior rectal artery. Sigmoid artery, supply yung sigmoid and the descending colon. Left colic artery will supply latter 1/3 of transverse colon and descending colon. And then si left colic at sa sigmoid, magkakaroon siya ng anastomosis yung marginal artery. Left colic artery will also anastomose with middle colic artery. So magkakonekta sila ni middle colic artery. Superior rectal artery will anastomose with middle rectal and inferior rectal artery, supplying your proximal anal canal.